Morning. All right, next question is from Patty. Good morning, Patty. Hi, Dr. Ben. I read something earlier on a study about an oral rinse of very dilute povidone. Okay, right, iodine. Yeah, which is a mix that it's that yellow stuff that surgeons would paint on before doing an incision to just kind of nuke any bacteria in the area so that they can get a nice sterile environment around the cut. Let's see. So oral rinse of dilute povidone, which is polypyrrolidone, which is a polymer with a no polyvinyl pyrrolidone. There we go. It's the pyrrolidone molecule with a nitrogen at the bottom, and that's hooked to the vinyl molecule, and the vinyl molecule forms chains, and so it's going to be these chains with these boom, boom, boom little molecules sitting off to the side. Which, whatever, you got a picture of it now. That's that's the only goal. And it's used as a thickener, a binder, a glue. It's fairly safe on people. Let's see. So the question is, can it kill COVID on the spot? Maybe, but here's the concerns. One, ingesting iodine like in large amounts, which is what could happen, is very bad for you, and it can result in loss of your kidneys. From what I've been reading. And so I would not want to do that regularly. As a one-time thing before surgery, yeah, all right, but not as a everyday rinse. The other problem is that the virus isn't coming from your mouth. That's, I guess, where it comes out, but it is going to be constantly supplied to your mouth from the places where it does grow, which is going to be back of the nose, down in the throat, in the bronchi, bronchioles, and in the alveoli, in the lungs. Those are the virus source. And so what you're seeing up in the mouth and the saliva is just the air that is coming out of your lungs as you breathe out is going to have some of these virus. And so every time you breathe out, you're going to replenish that population of viruses in your mouth. And then every time you talk, you're going to launch some of them out into the world like that. And so, you could clean it out, but it would last you about one breath. And it would also make the entire inside of your mouth maybe look that weird yellow color. Yeah, I don't know. It seems strange. So I think it's going to be probably too toxic to be of any real use. Let's see, second half of the question is talking about hydrogen peroxide rinses. Yeah, same deal. Unless you're rinsing the bottom of your lungs with hydrogen peroxide, which would be very bad for you, then you're not actually going to get to the source of the coronavirus. You're just going to take care of whatever came out in the last breath, and as soon as you take that next breath, you're going to have a brand new supply of virus in there if you are infected. So no, not effective. It's like it would knock out a virus if it was just on a plate or a kitchen counter or something like that. But for use inside of a person, I don't think there's any way to recommend that, at least based on the science, as far as I can see. So there we go. Good question. Yeah, because other people will have the same question, I am sure, and I'm glad you brought it up. Thanks very much. This is Ask Dr.